Hi everyone. Today we are going to learn about Hmpv, human metapneumovirus. I am Dr. Beulah Dallas, HOD, Community Health Nursing Department, Triple College of Nursing. Human metapneumovirus. It is a respiratory virus that primarily affects the lungs and the airways. It was first identified in 2001 and is now recognized as a common cause for respiratory infections worldwide, especially in children, older adult and immunocompromised individuals. Hmpv stands for human metapneumovirus, a single-stranded RNA virus which belongs to the Paramyxoviridae family. It causes infections similar to other respiratory viruses like RSV. Let's see the epidemiology of this virus. It was found globally and affects people of all the age groups, most common in infant and young children, elderly individuals, people with weak immune system, shows seasonal variations, usually peaking in late winter and spring. Spread occurs through respiratory droplets, that is through coughing and sneezing, direct contact with infected individuals, also contaminated surface. The causes of this virus infection is due to this metapneumovirus infection. Transmission routes were inhalation of infected droplet, close contact with the infected persons, touching contaminated objects and then touching the face. Risk factors of young age, especially below 5 years, old age, that is above 65 years, chronic lung disease, example asthma and COPD patients, immunosuppressive patients. Let's see the signs and symptoms of this disease. The mild symptoms are running nose, cough, fever, sore throat. And the moderate to severe symptoms are wheezing, shortness of breath, bronchitis, pneumonia. In severe cases, difficulty breathing, low oxygen levels, also respiratory distress may occur. Diagnosis through the clinical evaluation based on the signs and symptoms. Also, we can go with the laboratory test like PCR. It will be a more accurate diagnosis test for this infection. Viral culture, antigen detection test. Also, we can find out through the chest X-ray in severe cases to detect pneumonia. Management. There is no specific antiviral treatment for this infection. We can go with the supportive care treatment. That is rest and adequate hydration is very important. Fever management. We can give paracetamol as per doctor's order, and other fever management can be given to the patients. Oxygen therapy if needed. Bronchodilators if they are having wheezing as per doctor's advice. Hospitalization in severe cases if it is needed. Also for high-risk patients, we need to have close monitoring, intensive care if respiratory failure develops. The complications are pneumonia, bronchiolitis, acute respiratory distress, chronic asthma and COPD, secondary bacterial infections. If you are not treating in the mild and moderate stage, these are the complications may occur. How we can prevent this infection? So frequent hand washing is necessary. Avoid close contact with the infected individuals. Use of mask in crowded places. Proper cough ethic, that we need to cover the mouth and nose while you are sneezing and coughing. Cleaning and disinfecting the service surfaces. No vaccine currently available for these infections. Let's summarize this session. Human metapneumovirus is a globally prevalent respiratory pathogen belonging to the Paramyxoviridae family, primarily affecting children, elderly individuals, and immunocompromised populations. It is transmitted through respiratory droplets and contact with contaminated surfaces, with peak incidence during late winter and spring season. Management remains largely supportive as no specific antiviral therapy or licensed vaccine is currently available. Early recognition and appropriate supportive care are essential to reduce morbidity, especially in high-risk group. Let me conclude this topic. HMBV cause severe complications in vulnerable populations like children, especially underpaid children, old age population. Increased clinical awareness, timely diagnosis, and preventive measures are crucial. Strengthening infection control practices and advancing research toward targeted therapies and vaccine development are key priorities to reduce the global disease burden associated with HMV. Thank you for your patient listening.